Hi, Dr. Bender.
Hi, good morning.
Hi. So I see we took some fasting blood labs and I'm here to discuss the results with you.
Okay.
Okay. So for the most part, you aren't in bad shape. Your blood counts are fine, thyroid is fine. The majority of your blood level concentrations lie within the normal ranges. But I'm a little concerned about your total cholesterol, blood triglycerides, your fasting blood glucose levels, as well as your weight. You can see here that your total cholesterol count is 230 milligrams per deciliter. Your blood triglyceride count is 202 milligrams per deciliter. Your fasting blood glucose levels are 115 milligrams per deciliter, and you weigh in at 150.9 pounds.
Okay. What do these values mean, though? I don't understand.
Well, these values, when compared to norms, indicate that you fall just borderline of high-risk levels. As such, I'm sorry to diagnose you as a pre-diabetic. So this would mean this puts you at high risk of getting type 2 diabetes. Type 2 diabetes is a chronic, lifelong disease that prevents your body's cells from properly utilizing the hormone insulin. Insulin is secreted by the beta cells of the pancreas in response to a rise in blood glucose, and when bound to an insulin receptor found in the cell's plasma, acts as a key for the entry of glucose into the cells of the body. This is an integral part of our body's management of glucose to either be used for energy immediately or to be stored in the body for use later on. When an individual is diagnosed with type 2 diabetes, this means that the pancreas is no longer able to keep up with the body's demand for insulin production and eventually leads to a resistance in the body to insulin. This then causes the blood glucose levels to rise and can lead to further issues such as heart disease, vision loss, and kidney disease. It is important to note that once diagnosed with type 2 diabetes, an individual cannot be quote-unquote cured, but rather work towards managing the disease itself.
What does it mean to be pre-diabetic? Type 2 diabetes is generally preceded by a condition known as prediabetes. An individual being diagnosed with prediabetes will show fasting blood glucose levels that are above 100 milligrams per deciliter, but below 125 milligrams per deciliter. Having prediabetes means that your body is beginning to show signs of improper utilization of insulin, but at this point is still reversible. Some risk factors for prediabetes include being overweight, lack of physical activity or exercise, or having a parent or brother or sister that has a diagnosis for type 2 diabetes. If caught in this stage, there are lifestyle changes that can be made before a diagnosis of type 2 diabetes occurs. When an individual crosses the threshold from being pre-diabetic to diabetic, the condition is no longer reversible.
The exact causes of the development of type 2 diabetes are still unknown, though there is strong scientific evidence that shows a tie between lifestyle choices, genetics, and cultural background. Some of the lifestyle choices that can lead to a diagnosis of type 2 diabetes include a sedentary lifestyle, which includes less than 3 days a week of exercise, a diet high in both carbohydrates and fats that often includes a high consumption of processed foods, and being overweight. There is also a genetic role that plays into the diagnosis of type 2 diabetes, as obesity tends to run in families due to a shared genetic predisposition, as well as similar eating and exercise habits.
All right, so what can I do about this?
Well, I drew up a plan for you right here. So I'm going to go ahead and refer you to a lifestyle coach who will help you integrate some healthy habits into your everyday life. And we'll meet back in a few months, take another round of fasting blood labs, and view your progress from there. Here's your referral for the lifestyle coach and an appointment reminder for the next visit. I'll see you soon.
See you soon.
Good afternoon, Bethany. I'm your lifestyle coach, Parker.
Hi, good afternoon.
So I see you referred to me due to a diagnosis of prediabetes. I'm going to help you develop a plan to try and prevent type 2 diabetes. This plan will include both exercise and changes to your diet. And I'd like to see a decrease in your body weight of at least 7%, putting you in the healthy range for a 5'4" female like yourself. And hopefully this will create some permanent changes to your overall lifestyle.
Okay, that's cool. I still don't really understand how exercise plays into this though. Can you kind of fill me in on that?
Sure, drop and give me 20 and I'll break it down for you.
One of the best ways to prevent type 2 diabetes is through aerobic exercise. Aerobic exercise increases your mitochondrial density, insulin sensitivity, and cardiac output. Some examples of aerobic exercises are walking, cycling, jogging, and swimming. When beginning an exercise program after living a primarily sedentary lifestyle, walking is a great starting point. From here, you can increase both the intensity and duration of exercise as well as adding additional exercises to your program. This increase in physical activity will not only likely cause weight loss, but will also reduce the likelihood of your body developing a resistance to insulin as the uptake of glucose to your muscle tissue increases and levels of your blood glucose decrease. The addition of resistance training to your aerobic exercise program will provide benefits greater than if you were to only do one or the other. In the case that you do end up with a diagnosis of type 2 diabetes, exercise is still very important, and with proper execution can even manage it to the point of medication no longer being required to maintain healthy blood glucose levels. Exercise at a moderate intensity for 3 non-consecutive days per week, preferably 1 to 3 hours after eating a meal, as this is when blood glucose levels are likely to be higher, can greatly reduce the need for insulin therapy and usage of metformin. If you already use medications to control your type 2 diabetes, it is very important to test your blood glucose levels before beginning exercise as to determine whether or not the light snack is needed to prevent hypoglycemia.
Welcome back, Bethany. I've got some great news for you. Your fasting blood labs came back and your total cholesterol count is down to 190 milligrams per deciliter. Your blood triglyceride level is down to 140 milligrams per deciliter. Your fasting blood glucose levels are at 90 milligrams per deciliter, and you've lost a total of 10 pounds, putting you within a healthy weight range for a female of your height. I'm happy to announce you are no longer pre-diabetic and are not currently in danger of developing type 2 diabetes. Keep up the good work.
Yes!